Good morning. Good morning. I am so excited to have you all here today. My name is Jessica Pierce, and I am our MC today and the CEO and founder of Career Connectors. And we are just so thrilled that you all are here today for this AZ Careers Now event, which we are doing in partnership with the Greater Phoenix Chamber Foundation. And if you have not yet, I'd love to get you started engaged in our chat, because today we're going to be engaging with each other. So if you could go ahead and open up your chat box on the bottom of your screen, if you're on a computer, a laptop, open up the chat box and just drop it in there where you're joining us from, what your target career or industry or job is, and that'll get you used to using the chat. It'll also help us make some connections for everyone. So today we are doing this virtual healthcare career expo. Again, it's branded as AZ Careers Now. We are doing a series of these events. We did them for about the last year, and moving forward, and a series of hiring events by industry. And this is a partnership with the Greater Phoenix Chamber Foundation and Career Connectors. And so you're going to hear from the foundation in just a few minutes around healthcare and the industry and what it looks like. We are based in Arizona and have Arizona-based employers here, and I know we have people calling in from other places as well. So we will be talking about in-person jobs, on-site jobs. We will be talking about remote positions, virtual and hybrid as well. So a lot of great healthcare industry opportunities for you today. I'd like to go through a couple of the technical components for you. First of all, if you have any questions during the event at all, use that chat option on your screen. Just open up that chat and ask the question there. We have moderators on the call today that will be moderating and viewing those questions to make sure they get answered if they apply to the majority of people on the line. If they don't apply to the majority of the people on the line, they're more of a question personally for you, that's a great time for you to talk to the hiring companies when we go into the breakout sessions at the towards the end. So go ahead and use that as a question box. Everybody will stay muted today except for our speakers. And so we will have you just go ahead and put your questions in there. Now, a little bit about how you can best view this call. So if you go up on your screen to the top right corner, if you take your mouse to the top right corner, most of us, you will see a view option. If you click view, the best view is side-by-side speaker. And if you see side-by-side speaker, that is where you will see the PowerPoint that's being talked about and also the person speaking. So you should see right now the PowerPoint, and then you should see me on the screen. And that would be the best view for you today. All right. Let's see, make sure your name has your actual name. So we can, where your picture is, or where your picture would be if you have a picture or a video showing, there are 3 drop downs. And then in those drop downs, you can rename yourself. So find your picture, you can rename yourself and make sure it has your first and last name, so that if you are chatting with somebody, they know who you are. All right, so really cool thing, you're going to see that we're going to have some really cool breakout sessions today, and these are going to be a networking time for you to actually talk with the companies that are being featured today. I also want to make sure you also knew about closed captioning, and so if you need closed captioning on, just on the bottom of your screen, there is a show captions option. Click on that option, and then you will be able to see the closed captioning. You'll be able to see the live transcription that is on the screen and what people are saying, if that's helpful to you. All right, so if we can move on to the slide with the agenda, I want you all to see the agenda today. And so first, we're going to hear from Jennifer Meller, and she is with the Greater Phoenix Chamber Foundation, to give you an overview of healthcare, the industry, the trends that we see. And then we're going to have each company present for 3 to 5 minutes, and on their presentation, I'm going to mute everybody. Hang on a sec. Okay. All right. So on their presentation, you're going to hear 3 to 5 minutes, and it's kind of going to be a quick TED talk about their company, the types of jobs they have. You're probably going to hear something from them about what they like about their company, and then how to apply, and probably benefits too. So you're going to hear a couple things from each employer, and that'll go for just over an hour or so. And then I'll close it out at the end with some additional resources for you guys. And then we will move into the breakout rooms. And in the breakout rooms, you don't want to miss that piece. So you're going to hear about the companies first, and then you're going to go into the breakout rooms and the networking sessions. And that's where you're going to be able to jump around into the different companies and talk to the hiring manager, the recruiter, the talent acquisition director, whoever has come today to represent the company. So I encourage you to hang on until the end, and we'll close the call down right about 11:30. All right. So welcome, welcome, welcome again. If you have not dropped in your name, where you're calling in from, and your job type, go ahead and do that. One other thing we really like to do to get you all engaged is we like to have you drop in your LinkedIn URL. And so that way, when you drop in your LinkedIn URL, that helps everyone connect with everybody. So I'm going to drop mine in right now with instructions on how to pull your LinkedIn profile. Thank you, Alan. So you see how it's blue? Wendy just dropped hers in from Tenant Health. See how hers is blue? It's blue because it's clickable. And so with it being clickable, I can just click on it, jump out to LinkedIn, and connect to her directly. And the way that you make it clickable is, if you're on your computer, open up another browser window, go out to Google or whatever, go to your LinkedIn profile. And I usually just click on the picture, my picture. Once you click on your picture, it takes you to your main profile. And up in that search bar is your LinkedIn URL. Just do a right click, copy, and then paste it right in here. So I will drop the instructions one more time, and I'll drop the instructions throughout the call today as well. So I encourage you guys to connect with each other. Connect with each other in the call, on LinkedIn, ask questions to employers. Our employers are watching the chat today, and they're going to do their best to respond to your chat questions as well. You can ask questions of the whole group. You can also ask questions individually. And when you'll see, if you're asking just individually, your name becomes red, so the person, it stands out. So if you're on your phone, usually it's different depending on which phone you're on, but there are 3 dots on your phone somewhere, like they look like a drop down. So 3 dots, if you click on that, usually the chat is in there. You can rename yourself in there. And so that's the area. Same thing, you go out and you get your LinkedIn URL, copy it, and then paste in the chat. So that process is the same. All right, well, get started. Hold on tight, because you're going to be hearing from a lot of people this morning. And then make sure you're taking notes. This call is being recorded. And so that means after the call today, you will get an email that has the link to the recording. You will also get an email that includes the job boards for every company. So I know that's a lot of writing. You don't have to write everything down. You can see, like Robin just jumped on from Honor Health. She dropped in her LinkedIn URL and her job board. So you'll also see that coming from the companies today. The links will work, and just click on those and they'll take you out to the job boards. But you will get an email with the call link, the recording, and then the job board, links to all the job boards, as well as a whole bunch of other resources that AZ Careers Now has for you. All right, you guys, let's get started. I am so honored and excited to introduce you to Jennifer Meller. She is the Chief Innovation Officer with the Greater Phoenix Chamber Foundation. Thanks, Jennifer, for being here today.
Yes, thank you so much for having me today, Jessica. So great to be with you all this morning. I'm just looking through the chat box, and it looks like we have a wide gamut of folks on the call today. I see lots of people that are looking for remote jobs, some folks that have years and years of experience, maybe some career changers, and then also folks that are just finishing up their education and looking for opportunities. And this is a really, really great place for all of you to be. I just want to share a little bit about what is happening in the healthcare job market from a data perspective. And then I'm going to turn you over to all of our employers to hear a little bit about them and the unique opportunities that many of them have available. So if you want to go ahead and go to the next slide. Quick spoiler alert, if you've been on any of these events over the last year and a half, I think it's been, Jessica, we still hiring. And I think you're hearing a lot about the labor market kind of softening, and there is some shift in the market, but there are still a number of companies that are looking for qualified talent, and the healthcare sector is probably at the top of that list. So go ahead and go to the next slide, please. And this is, I'm not going to do a lot of graphs, data charts, but I think this kind of explains why. When you look at the number of job openings available, if you look historically back to pre-pandemic, we were hovering just under 8 million jobs in the job market that were open, which was about equal with unemployment. So we saw a huge dip in that, obviously, when COVID hit. But since we've been recovering over the last 6 to 8 months, last year and a half or so, what we've really seen is just this steady number of open jobs available. And when we look at what's out there today, we have just shy of 11 million jobs that are open right now, which is well above the number of people that are out there looking for work. So this is a really great time for all of you to connect to employment opportunities. Next slide. And just kind of reiterating that point, you can see that Arizona is just slightly above the national average of unemployment. When you look at what that's done year over year, we've had just a slight increase over prior years. But when you look at Maricopa County, where we're sitting, you can see that our unemployment is really, really low, under 3%. And you're going to always have that natural unemployment. So this basically tells me that we're almost at full employment here locally in the market. So again, it's a great job seekers market, and I've got a little fly in my face. Gotta love that. Next slide, please. So here's just a couple of estimates when it comes to healthcare and job growth within the healthcare sector. Healthcare has always been one of our fastest growing industries here in Arizona, and as you'll see here, is projected to continue that trajectory. So we have just shy of 500,000 jobs available currently in the healthcare and social assistance space. That's projected to exceed 500,000 over the next 10 years, with a 14% increase year over year. And then you can see a little bit of a breakdown into the types of jobs that are available. When you think about healthcare practitioners and technical occupations, those are your physicians, your pharmacists, your registered nurses. When you go down into the technologists and technicians, those are your lab techs or your surge techs and those types of mid-level roles. And then we have a lot of healthcare support occupations. Those are your medical assistants and other types of entry-level roles that are a really good way to get a step into the medical field. So next slide, please. And here is just kind of a quick layout of some different opportunities, different pathways, and just different expectations. What you'll see across the board here, and this is obviously not a comprehensive list by any means, but just a couple of examples. You have some clinical technologists and technicians that require a bachelor's degree that are making roughly $50,000 a year, obviously continuing to see a growth in that sector. But you can also get into an entry-level role as a dental assistant or a medical assistant with some sort of post-secondary education, not necessarily a full bachelor's degree or even a full associate's degree. Again, that's a great starting average salary and a really good way to get your foot in the door. And if you go to the next slide, There's just a couple more positions here I'll highlight. Obviously, many people are familiar with registered nurses and respiratory therapists. Again, these are really great career paths and RN here locally. Now, this data is timely, but it continues to evolve. Nurses were making over $80,000 a year with a bachelor's degree. I can guarantee you that that number has increased over the last several months as this data continues to evolve. And then as you look at therapists, and again, those technologist types of roles, those are really great opportunities to get into the field with an associate's degree, making a really great living wage with lots of upward mobility. And next slide. So really, here's my contact information if you want to reach out. I also have my colleague, Jill Bushbacher, on the line that would be happy to connect with you all as well. But again, there's so many different career opportunities in the healthcare field. I encourage you to connect with the employers and find out what they're looking for. It could be something in the clinical space, but all of these organizations are also looking for folks in environmental services or food service or IT, or there's always different careers that you don't even know about. So excited for you all to get to connect with them today. And I will turn it back to you, Jessica.
Awesome, Jennifer. Wow, such great information. Thank you for bringing that today. We appreciate it. All right, guys, we're going to move into the hiring companies. And one thing I wanted to also let you know is at the end of the call today, before we go into the breakout rooms, we will be giving away a couple $50 Amazon gift cards. And we're going to do that because we're looking for you to answer some three, maybe five quick survey questions right at the end so we can collect data. So because we're on a grant, so any data we can collect is super helpful to allow us to have these programs to continue. So let's get started with Wendy Fitzpatrick. She is an Arizona market supervisor for Abrazo Health.
Excuse me.
Hi, Wendy. Are you on the call? Somebody else.
It's like anything in Boston, Mass.
Let's see where, if everyone could please mute. We are going to allow Wendy Fitzpatrick, if you'd like to chat. There is a chat box in the at the bottom of your screen. You may use that to talk to us, but we're only allowing speakers to talk today. So let's see, we're going to find Wendy and unmute her. Hi, I see you, Wendy. You can go ahead and unmute now.
All right, thank you so much. And thank you, Jennifer, for sharing all of that. That's a lot of what we like to speak to. And feel free to play the PowerPoint. I'm going to talk about our organization and you can review some information. So if I forget some details, hopefully it's on our PowerPoint. So I am with Tenet Health. We are known as Abrazo Health in our Phoenix market. We have quite a few facilities and we are in Phoenix, Goodyear, Glendale, Scottsdale, Cave Creek, Buckeye. So popping in all over the valley. We are anywhere from entry-level positions. We're always excited to train new staff. We definitely need environmental services. We need patient care assistants, transports. We need people that'll do pretty much everything on site at the campuses. So it's a lot of opportunities available. In addition to our licensed healthcare staff, we're always recruiting for RNs, of course. We have an excellent new grad program, as well as many other opportunities through our system that enables you to participate in our benefits. We have sign-on bonuses. We have tuition reimbursement. That's $5,250 a year. Of course, the typical paid time off, all of those things. But what's most important is we recognize that we are better together, and our facilities are really ran by our culture, which is pretty special and unique. A lot of our team members have been with us 10, 15, 20 years, and we are pretty strong in the market. We're happy to be here. We're bringing some of the most exciting technology to our campuses. We're the first to have quite a few things now, so that's very exciting. We have our sister market in Carondelet Health Network. That's in Tucson. So we are throughout the entire state. And with our brand Tenant Health, we are nationwide, including Boston. So we have a lot of exciting things to offer. I have inserted my information. I will send it again. We're here to answer any questions. If you're looking for entry level, somewhere to start, somewhere to grow, we are better together, and look forward to speaking with you and following up with your applications. Thanks so much for letting me speak today. I hope you all have a great day.
Fantastic. Thank you so much, Wendy, for being here. And again, if you were not here right at the kickoff, you can talk directly to these hiring companies after we get through the presentations at the end when we go into our breakout sessions. So drop your questions in the chat or go ahead and write them down for the individual questions for the companies when you get to talk to them in a little bit here. All right, let's bring on Christopher Owen. He is a talent acquisition specialist with Adelante Healthcare. Hi, Christopher.
Good morning, everybody. Excited to spend a couple minutes and tell you a little bit more about our company here. Like Jessica said, my name's Chris. I'm a recruiter over here with Adelante. We are a local nonprofit that was founded back in 1979. And what we are is a network of federally qualified community health centers, which is a mouthful. FQHC is for short. We are local to the Phoenix area here. And these community health centers are located in areas of the community that are shown to have more limited access to preventative health care. And they offer a variety of services, including primary care, dental, behavioral health services. Many of them also offer like pediatric OBGYN and women infant care, like nutrition services as well. So a lot of great services for our local folks here. We have 9 of these health centers throughout Maricopa County, one central office located in Midtown Phoenix. And we're about 800 or so, 800 and change employees now, with plans to, continue to grow and add more health centers and more providers over the next decade or so. And that's why we're here. We need a whole lot of folks for all different kinds of positions to, keep what we're doing going here. A little bit about our positions themselves. All of our positions, they're full-time permanent jobs with full benefits. All of our benefits are effective day 1 of employment, so there's no waiting period to get on our benefits here. And they include, medical and dental and vision plans, strong time off program, 5 total weeks to start, as well as a pretty strong employee development program, which includes tuition and certification reimbursement policies for what you're going for there. We have honestly open positions at most of our locations right now, everything from front office assistants to medical assistants and behavioral health techs on that entry level side, everything all the way up to, our more administrative folks, our managers and our actual providers here. And we're also hiring for a number of positions at that corporate office, HR professionals, IT support, paralegals, all the other stuff, that makes an organization work. And a lot of those positions are hybrid remote positions, although, being a local nonprofit, definitely very interested in folks, that want to serve our community in particular. You can check out all those open positions on our careers page. That's address is listed below, pretty basic there. You can also reach out directly to our talent acquisition team via that email address or that number on the page if you have any specific questions. And that's all I got. Thank you so much for spending some time with me this morning, getting to know us a little bit. Look forward to chatting with you a little bit more further on here.
Fantastic. Okay, thank you so much for being here, Christopher. Again, you will be able to speak to him during the breakout sessions here in just a little bit. All right, I'd like to introduce you to Roger Adams. He is with CVS Health and as one of the store managers. Hi, Roger. I know he's on. He was having.
Got to do that magical unmute button or else we're never going to win. Got to do that at least once every time we do a call. Welcome to the world, right? Good morning, everyone. Afternoon for those of us joining from all over the country. I'm excited every time I do one of these career connection events. Just as Jessica said in the beginning, guys, some of the networking that I've done, even outside of just employment for people bringing on some of the people we have met in our industries. This is an outstanding opportunity. Ask great questions. Ask just, hey, what's going on? You might not even realize of opportunities that you might have opened up to you or connections you can call 6 months from now. So be very active in the chat. Ask questions in the breakout room. This is your time and we're here because we love having the time with you. So once again, my name is Roger Adams. I am from CVS Health. I am a regional recruiter for the state of Arizona, but I do help enterprise-wide. CVS is lucky enough to be the 11th largest employer in the state. And my very favorite thing to do whenever I get one of these calls and opportunities to meet you all is finding an opportunity that you didn't even know that we did. It's not just mascara. It's just not pills in the back room in the pharmacy piece. So if you guys want to jump to the next slide, let's just kind of talk about what we're currently looking at for in the state of Arizona. These are immediate placement roles. Benefits start within the first month. If you begin with us at first time, we're looking for leadership opportunities for store management, obviously for pharmacists in multiple platforms, from the retail side to mail order facilities to our specialty infusion cares, all over the industry, some great opportunities. Nurses from in-home nursing care, tons of opportunities in nursing, truly supervisors, even entry-level associates. Currently, just pulled it up this morning. I always look at before we start it. There's 798 postings in the state of Arizona for the opportunities in Arizona. We also have 27,000 postings nationwide right now active on our website. If there's something on there that you see and you go, hey, this is kind of exciting. I never knew that CVS did that. Or Aetna, by the way, that's us. Or Caremark, hey, that's us. Specialty, oh, that's us. Quorum, that's us. We are the largest healthcare company in America. We're the fourth largest company in the Fortune 500. We have some unique opportunities because of the job portability that comes with it. So starting in our platforms, we'll get you nationally certified as a pharmacy technician. We'll provide the training and development to get you to become a store manager or a lead group technician in a call center. There's a lot of development where if you bring your skill set to the table, we'll upskill you to our industry. We're looking for the brightest and the best to come play with us. I have posted in the chat about a couple times, and we'll do same in the sim breakout room. Best way to get a hold of me for direct questions is through the LinkedIn platform. That way I can send links to you, referral requisition requests too. So if there's an opportunity that you really love, let me get you a chance to apply to it directly so you don't have to go through all 21,000 jobs on our website. So please do reach out to me. I can't wait to see you guys in the breakout room. It's always awesome to be on here with Career Connectors. You guys don't know how Jessica really does plug into some opportunities. And again, pop me a direct question before, after, group chat, whatever. But thank you for the time today, guys. Really looking forward to some great talent today.
Fantastic. Thank you so much, Roger. Hey, what does CPHT stand for?
I am a certified pharmacy technician. I have passed the PTCB certification board. So I can, with the permission of the state I am operating in, their board of pharmacy, I can practice as a licensed technician and do almost everything from immunization to dispensing, everything but the final step the pharmacist does. So it is the credential you are required to have, which again goes to that job portability. Hey, if I'm nationally certified as a pharmacy technician and my partner, my spouse, whatever, and we move to Georgia or New Jersey, there's a CVS where you land. I got a job right next to the apartment and I don't have to go drive across town because, hey, there might be a CVS on the corner or even one of our Target platform stores. We have Target, all the Targets in the country bought their pharmacy platform about 5 years ago. That's a CVS inside and I'm right on the schedule and I'm still doing the same job and I don't have to go look and I can still cover my bills. Sometimes I can't tell you how many people that have left our business, we're their side hustle for 10 years because they're like, well, it's hard to not work a couple shifts a month. We will do that for you too.
Oh, fantastic. Roger, it's been just such a pleasure to watch your career joining CVS and then everything you've done there. Congratulations on that. And thanks for being here.
Thank you, guys. I appreciate it. Good luck to all the presenters today. Let's go. Let's rock it, guys.
Okay, let's move on to the Donor Network of Arizona. We have Kristen Ransom, and she is a HR specialist and recruiter. Welcome, Kristen.
Hi, good. Well, welcome everyone. I'm so happy to be here today and to be able to talk with you about Donor Network of Arizona. So let's get started. So Donor Network of Arizona is actually the only federally designated nonprofit procurement organization serving the entire state of Arizona. And so we help, of course, any of the folks in Arizona or outlying areas to be able to receive the gift of life, whether that's through organ donation or improving eyesight through cornea donation or tissue procurement, which will eventually help many people. And so our mission is to make the most of life through the gift of organ and tissue donation. And of course, we challenge ourselves and others every day to realize Arizona's potential to save and improve lives. And that's the greatest thing I think I can say about our organization is that none of the work that we do would be possible without the generosity of others and their willingness to give the gift of life and healing to other folks. So, next slide. Thank you. So yeah, Careers at Donor Network of Arizona. So first off, I'd love to start out with, Donor Network of Arizona actually won top companies to work for in 2022 in the state of Arizona. Woo! So we were super excited about that. And I think that really speaks to the culture that we have at Donor Network of Arizona. We do a lot for our employees, and we have generally overall higher retention rates than most healthcare across the state of Arizona. We have a lot of wellness differential programs that we have that really give us outstanding benefits to our employees. For example, I'll just give you one off the top. One of our plans for Cigna is a $500 deductible for employee only is only $110 a month, and they only go down from there. So we're really proud of those. We have two dental plans that are under $9 a month, and our vision is under $7 a month. So that really can't be beat. And then we have Voya. We are a nonprofit, so we have a 403B with employer match at 5%. And we also have tuition reimbursement and some great opportunities. And we really support our employees and really just try to make it a great cultural experience as well. We actually do have quite a few different things that we are involved in as a community. We have a diversity, equity, and inclusion program, which is awesome. We really celebrate diversity. Of course, we want to heal the lives of all of our, all of the people in Arizona, and we're very inclusive as an employer. We only feel like, with diversity, we grow stronger. So we love, people from all backgrounds to apply for our positions. We also have a community involvement committee, which we help other nonprofits and raise awareness for their nonprofit organizations. And then we have a Planet Posse committee and many other committees that we encourage people to join, not only to give back to the community, but also as a networking within our own organization so that people feel welcome and they can be a part of our community. There's currently around 250 people at Donor Network of Arizona, and we hire from a range of positions that you can see here. So we hire organ recovery coordinators, and the skill set background for that position would be critical care nursing. Currently, I have a position available for a medical referral donation scribe. I hire respiratory therapists for that, scribes, LPNs, surgical preservation, anyone with an OR background. So that could be anesthesia technicians, that could be surge techs, anywhere in that realm. And what they do is actually go in the OR and they package astolic donors. So it's a really exciting position and a great opportunity. Most of these clinical level positions also have levels. So you can start out as a 1, go to a 2, a 3, and 4, and then go on to the next level position. So there's a lot of growth opportunity within our organization. And we have a new position that we're going to be opening here in the next month called Organ Donation Coordinator. We're going to be hiring paramedics and RTs for that position as well. And then we have 8 different departments at Donor Network of Arizona, and we have clinical support careers, such as our donation and family advocate. People that do well in that background usually come from bereavement counselors, they're chaplains, they've worked in crisis situations. And then we're also hiring donor support coordinators, and that's kind of like a dual role where they're clinically background, they have a clinical background, but they also have, experience maybe in speaking to families. And so we're looking for, of course, diversity in all of those positions as well, because we're reaching everyone in our community, and we love multilingual people. We love people from many backgrounds and cultures to really connect with our communities. But some of our departments are IT, HR, finance, quality. We have a supply chain, tissue, of course, organ recovery, donor program development, which is hospital development. So if you do have a background, let's say in health administration or public health or something like that. That's very applicable to our positions as well. So yeah, we would love to have you come talk to us a little bit more if I've put the nail on the head on any of these positions for you, and it would be wonderful to meet all of you. And here's my contact information. So feel free to reach out, and there is a link to our careers page, and I'll see you all in the chat.
Fantastic. Thank you, Kristen. What a great organization and the work that you guys do. Thanks for mentioning your award, Top Companies to Work For in Arizona. So the Best Companies AZ team is on the line. If you guys have not connected with Best Companies, make sure you do. They work with a lot of clients that are award winners, just like Donor Network of Arizona, and Denise Gredler was dropping in some information about them in the chat as well. So thank you for being here today. We really appreciate it. All right, a couple reminders also, if you have not dropped in your LinkedIn URL in the chat, go ahead and do that so we all can connect with each other. I am having a great time talking to some of you offline through the LinkedIn platform. And then just a reminder, we're giving away two $50 gift cards at the end of this call before the breakout room. So hang on and we'll tell you how to get that, and we'll give away two while on the line today. All right, I'd like to introduce you all to Juan Gonzalez. He is the HR manager for Hacienda Healthcare. Hi, Juan.
Hi, good morning, everybody. Thank you for giving me the opportunity to be here. My name is Juan Gonzalez. I'm with the Hacienda Healthcare. We are Arizona's leading provider for specialized healthcare services for the medically fragile and chronically ill, as well as those with intellectual and developmental disabilities. Currently, we have our main facility on 16th Street in South Mountain Avenue, and we have 8 supported group homes scattered throughout Phoenix metro area, both nursing and non-nursing group homes. And so we also have a day treatment program for adults who are trying to transition into the workforce. So we work with various level of individuals with autism to help them transition to the workforce as possible. And we also have a home medical service where we actually go to the private homes and help set up ventilators and oxygen tanks for those individuals who have to be trached or constantly on oxygen. So we are looking for a variety of different positions in our organization. Currently, we're looking for registered nurses, both full-time, part-time. As you can see, we have I would say, a very competitive hiring bonus as well for our LPNs as well, both full-time and part-time, and PRNs will offering sign-on bonuses for all 3 areas. And also, I didn't put it on here, but we have a sign-on bonus for respiratory therapists as well too. So it's a great place to work. We have residents that have been in our facility for a majority of their life. So it's a great way to get to know them on a one-to-one basis and get to know their families, because the families really trust us to take care of their loved ones who are unable to take care of themselves if they're at home as well. A great facility, updated healthcare. So it's a great place to be at. We offer competitive benefits. All the typical benefits. We're a 403B plan that will match up to 4% on your 403B. So it's a great place to be. And if you're interested, I'll just drop my information in the chat.
All right, thank you so much, Juan. Again, we are going to have him available to speak to you at the breakout session. We're going to be, you'll see a little switch on our screen. We missed a PowerPoint, so we're pulling in City of Hope. So get ready, City of Hope, you're next. Just a reminder, we are doing those 2 $50 gift cards before we go into the breakout sessions. And if you're just jumping on, we've had 10 or 15 people jump on in the last couple minutes. Just a couple things. We're going to go through we have about 8-ish more presenters. And these are the speakers for the hiring companies. They speak for 3 to 5 minutes. And then at the end of that, around 10:30 Pacific time, then we're going to move over to the breakout sessions where you'll be able to talk directly to the hiring companies. And so right now, I'd like to introduce you guys to City of Hope. Jill Leiden is with Talent Acquisition. Hi, Jill.
Hi, everybody. So nice to meet everybody and happy to represent City of Hope, which some of you may know as the former Cancer Treatment Centers of America. City of Hope is a large cancer research facility based in California and acquired Cancer Treatment Centers of America in late 2021. So we are growing tremendously, and because of that exciting acquisition, we now have over 11,000 employees nationwide. In Arizona, our main campus is in Goodyear. We also have some outpatient care clinics in Gilbert, North Phoenix, and North Scottsdale. Next slide, please. So my colleague Adrienne and I will be in the breakout rooms, and Adrienne is our senior nurse recruiter. She has various roles for ICU as well as stem cell. And we do have an exciting new nursing grad program. The next cohort class is in the fall. It is a 16-week program. You must have a BSN and have passed your NCLEX to participate. And the first 2 weeks of that program, you actually will be in California training. So great opportunities. Please definitely talk to Adrienne if you will be graduating soon, or you're an experienced nurse, because we also have, again, these ICU and stem cell roles, as well as we're looking for oncology nurse navigators. I work with the other opportunities, so allied health, looking for medical assistants all the time. I have currently 2 openings in Goodyear, as well as 1 in North Phoenix. We did fill our North Scottsdale position. Senior pharmacy techs, have various respiratory therapist roles open overnight, as well as a day shift role just opened in Goodyear. Looking for a surgical APP, as well as occupational therapist per diem, as well as 2 pharmacists. We had 1 opening, we just now have 2 openings. So please reach out to Adrienne and I in the break rooms, as we are growing tremendously. Next slide, please. Here is our contact information, and some exciting things concerning our Goodyear location is that we have been magnet designated since January 2022, and we are a nationally accreditation program for breast centers. We have the Joint Commission Gold Seal of Approval for Lung Cancer Certificate. And a little bit about our benefits. 2 really great things that stick out with our benefits is our PTO. It's very competitive. You do receive PTO time immediately upon hire. So there's no waiting period. And our 401k, you're not only fully vested right away in your contribution, but also on City of Hope's contribution. So there's no waiting period on of that for your 401k as well. So really look forward to talking with you. I know Adrienne's excited too, and talk to you soon.
Fantastic. Thanks, Jill. Thanks for being here today.
Thank you.
All right, we are going to move over to Robin Ursulin. She is the Talent Acquisition Marketing Specialist with Honor Health. Robin, thanks for coming back.
Oh, hello, everyone. Thank you very, very much for having me. I always really thoroughly enjoy being able to connect with everyone and the career connectors, and also with AZ Best Companies. Wonderful folks. So thank you all very much for being here today. Throughout the chat thread, I've dropped in our career site, my email address, as well as also my LinkedIn connection, which I see certainly folks are kind of already on it. So thank you very much. All right, so next slide. Oh, there you go. All right. Yeah, so as Jessica said, I'm Robin Ursulin. I work on the talent acquisition team in a marketing specialist role with Honor Health. So I am more than happy to speak to many different types of careers here with us, also company information, as well as also provide career navigation assistance, because lots of you on the call today may be looking forward to either starting, in the healthcare career, or you may be a very seasoned professional and you certainly kind of want to look at the, top opportunities, maybe leadership, possibly remote, some hybrid. Everyone has got kind of different needs out there these days, so I'd be happy to kind of talk through those. All right, so Honor Health is a hospital system based here in Phoenix and Scottsdale, Arizona. Now, we do have a wide variety of different, also your urgent care, your specialty, as well as also your medical provider groups that are scanned all throughout the Phoenix metropolitan area. So our footprint's kind of gradually growing here in the Valley. So look forward to being able to share some of that with you. We've got some wonderful awards and a lot of different accolades that Honor Health is certainly kind of, proud of being able to, take care of our community as well as also take care of our employees, very well as well. All right, so next slide. Okay, thank you, Jessica. All right, so here's a good bit of information, right? Some good highlights about Honor Health. Kind of gives you a little bit of where we're located in the Valley, our main 6 hospital locations that are here. Also, we've got 2 kind of complex care locations that are open. There's one over in Surprise, and then as well as also a new one that's opening at Tatum and Shea in the Phoenix area. All right, so here with us at Honor Health, I mean, yes, being a hospital system, we're all about taking care of patients. But Honor Health also does a really wonderful job of taking care of its people as well. I've been very fortunate to have a wonderful career with Honor Health. I think September will be 25 years for me. So some of you that have been here in the Valley for a while, you remember the Scottsdale Healthcare, John C. Lincoln. We came together to become Honor Health. So I've seen our company kind of grow and expand, and the different opportunities that we've been able to offer and expand being a part of a larger network as well here in the Valley. So wonderful benefits you can check out anytime at honorhealthbenefits.com. But as far as more career specific, we certainly have some nice enticing, I'll just say, sign-on bonuses. So many of our positions do, offer those as well. They start ranging about, $2K and on up into higher amounts, depending upon, full-time, part-time, the nature of the role, experience, and all of that information as well. I'd love for you to follow us on our Facebook page, our LinkedIn page, and also reach out to me directly, because many of you kind of just would like to just dial in to see what opportunities that we may have. Certainly different roles within our nursing support areas, which will be, your CNA, PCT, patient sitters, transporters, registration schedulers. Also we do have an RN new grad residency program if we've got some up and coming grads on the line, as well as also many different roles in our allied health areas. So certainly, your farm tech roles, lab roles, wonderful career paths to be able to help kind of guide you through that. And then we do have remote opportunities as well. If you head on over to honorhealthjobs.com, there is a filter search there that does basically point out, if you want to hit, yes or no, to remote. So you can see we do have some remote opportunities. It could be more in the business operation sides, possibly IT, but more of our medical billing coding, areas. But let's connect, and I'd be happy to kind of get you moving in the right direction. So thank you very much for your time today, everyone.
Awesome. Thank you. Thank you, Robin, for being part of our program for so long and hiring people. And it's just been awesome to watch you and you guys grow. And so thanks for being here today.
Of course. Thank you.
All right, we're going to move over to the Arizona Department of Health Services. This is the state hospital. So we have Roberto Valenzuela and Angel Velasquez, and those are senior HR analysts and assistant CNO. So welcome, Roberto and Angel.
Hello. So, like you said, my name is Angel. I'm the assistant chief nursing officer here at the state hospital. I've been here for about 2 years, and I really love working in this facility. So we're a facility that cares for inpatient psychiatric facility that cares for the sickest in the state of Arizona, whether it be bipolar, schizophrenic, borderlines. There is actually a wait list just for the patients to get into this facility. So we were hiring for psychiatric nurses, behavioral health techs. We have various security positions. So the nice thing about this hospital, I always feel like it's like a small hospital setting, even though we're a large property. Because you get to know individuals from the CEO all the way to the housekeeper by their names. So that's one thing that I enjoy working here is that I get to actually get to know the staff. They know me. I give them my cell phone number. That's very, very rare that you see in healthcare, that you see that you get to have administrators' numbers. So that's one of the reasons why I want to continue working in this facility. Roberto will go over a lot of the information as far as like our benefits, which because we are a state agency, we do offer a lot of state benefits.
Next slide, please. Okay, my name is Roberto Valenzuela with the Arizona State Hospital, and because we are an inpatient psychiatric facility in Arizona, most of our jobs are clinicians in behavioral health. Some of them require different levels of experience and academic preparation, but we have a few that don't require any experience, like the security officers, the BHT rover, and the residential program specialist 1. The only requirement for all of us is to be able to obtain a level 1 fingerprint clearance card. We also treat all adult SMI population. I know it can be a very difficult type of job, but everyone in this field is here for providing compassion care. All of these jobs are in one single location at the state hospital, and the hospital is located on 24th Street between Roosevelt and Van Buren. Commuting to the hospital is very easy because the 3 main freeways are close to the hospital, like the Loop 202, the US 51, and the I-10 as well from south part of town. In addition to this, all of these positions are eligible for the what I think very great benefits, very competitive, and extremely affordable. As an example, one of the plans, health insurance for the family, it's under 57 per pay period. And we also have the Arizona State Retirement System, which is a guaranteed pension. You put in your 10 years and then more, and that's more time you put into your employment. You accrue more towards your pension. In addition, we have like 5 different buckets of time off, all separate from each other, like vacation time, sick leave, different types of leaves as well, like military, bereavement, and civic duty, and holiday, it's 10 days per year. To apply, you will have to go into the state website, and it can be a bit overwhelming. However, if you type in Arizona State Hospital, then click on the search button, it will give you all the jobs that we are currently recruiting and aggressively hiring for. Also, it includes the compensation within the job posting as well. I hope to see you in the breakout room. Save your questions for then. And the next slide will have my contact info and how to email me and give me a call or text me as well. Thank you so much.
Thank you, Roberto. One of the things I love about the state of Arizona positions, and this goes for all of the state of Arizona positions, is a recruiter looks at every single application that comes through and puts their eyeballs on it. Is that still true, Roberto?
Yes, we have a team of 11 recruiters and a recruiting manager as well. And we all have a different, so I support the state hospital along with 2 other colleagues. And then the other recruiters support the main Department of Health Services location as well.
Awesome.
However, everybody has to apply online before one of us can see your application or resume. Just keep
That's
that in
right.
mind.
So once you apply online, somebody will look at your resume. So I think that's just your application. So I think that's just a great benefit of knowing that you'll get eyeballs on your information if you go through this system. So thank you so much for being here. We appreciate you guys.
Our pleasure. Thank you.
All right. Okay, we're going to move on over to Alan Riggs. He is a senior recruiter with NOAA, which is the Neighborhood Outreach Access to Health. Hi, Alan.
Hi, good morning, everybody. Thank you for having me. So, Noah, I'll give you what we call the movie trailer version of who we are. So, we have been around since the mid-90s, and we are a federally qualified health center. So that means that we never turn anybody away based on their income or insurance status. We just simply do what's right by the patient. At all of our locations throughout the valley, which is from Glendale to Scottsdale, we provide medical, dental, behavioral health, and dietetic services to all of our other patients. Our patients range anywhere from pediatric and to geriatric and all steps in between. So the positions that we're looking for are, of course, all of our patient-facing positions. But in addition to that, we offer and we have positions available for entry level. So if you're looking to get into a corporate office, or you're looking to get into medical assisting, we actually have a medical assistant training program where we will train you to become a medical assistant. It's a paid program. So we work with individuals who are looking to become coders. We work with individuals who are looking for customer service jobs. And so we even have community resource specialists. And the role they play is, for example, if a dietitian is working with a diabetic and they find that the individual cannot follow their nutrition plan as a result of food insecurity, well, that's when our community resource specialist steps in and helps the individual get access to the programs that are in place to help with that need. We look at total patient, and I know that everybody out there has, it's hard to find an employer that doesn't have benefits. It's hard to find an employer that is in the healthcare field that's not looking to improve the level of care. What we do at NOAA, in addition to improve the level of care, we look to improve the level of caring. So if that makes sense to you and you want to be part of something that matters and be part of something that's much bigger than yourself, well, then you need to come talk to me and look for me in the breakout room. So I appreciate you having me here today. I look forward to speaking with many individuals. This is our contact information. And again, that's NOAA, Neighborhood Outreach Access to Health. Thank you.
That's fantastic, Alan. I love that about caring. What a great way to really talk about the culture of your company and what you guys are doing there. Thank you. Thanks.
And one other thing that I forgot to mention, and I apologize, as a FQHC, for individuals who are looking to qualify for those HRSA loan repayment programs, we do that as well. So you are working for us, that would enable you to qualify for the HRSA loan repayment program. So.
And what does that mean?
So that is individuals who are healthcare providers, whether it be behavioral health or medical. If they work for an FQHC, then the government will help pay back their student loans.
There you go. That's a huge benefit. Thank you.
Absolutely. Thank you.
All right, great. And just another note that if you just jumped on recently, we are hearing from our hiring companies right now. And then in a few minutes, we will drop into breakout sessions and you'll be able to engage with these different hiring companies directly. So hang on for that. I'd like to introduce you to Phoenix Children's, and we have we have Andrea Gerhardt is here to represent Phoenix Children's. Hello, Andrea.
Hi there, Jessica. Sorry, we did a little switcheroo for you there, keeping you guys on your toes. Yes, well, yes, again, my name is Andrea Gerhardt. I'm a recruiter with Phoenix Children's. And also joining me on this call today is my colleague, Danielle Hopkins. So hopefully you have the opportunity to meet with her in the breakout rooms. She'll be available as well to connect with you all. I know I have a few minutes here, so I'll try to keep it certainly brief, but get to all the fine points. So lots of exciting movement happening with Phoenix Children's. You may have known us as Phoenix Children's Hospital. Of course, in the prior years, we are now growing, of course, in expansions. So we are now Phoenix Children's healthcare systems. So what that means, East Valley, we have Women's and Children's Pavilion. You may have heard or seen our hospital popping out in the East Valley. We have partnered with Dignity Mercy Gilbert in offering both women's care and children's care. So we've partnered on bringing that unity together, where Dignity will continue holding the maternal side, labor and delivery, postpartum, and we will then venture to provide that pediatric NICU neonatal care so we can keep mother and child together. So that's exciting to come, and we will be actually begin hiring practices in about 2 months. So keep an eye out. The QR code will certainly take you to those new opportunities for the East Valley. Now let's venture to West Valley. Avondale, you may have seen our handprint right off the tent there, urgent care specialty clinics that we've had at that location for a handful of years now. We are excited to announce that we are opening our new freestanding emergency department. And so, yes, we know that Glendale, West Valley is booming, and I know it just continues going. Even when I drive out there, I can't believe how much the growth is. And so now we are offering families out in the West community that emergency department care alongside with the urgent care and the day specialties. Now that's all 2023 and the summer months coming about. Now let's take a hop over to Arrowhead, Glendale area. 2024, we will be opening up our newest freestanding hospital. So just like East Valley Hospital, the main Phoenix campus hospital that we've had running there, we will have a hospital in Arrowhead. And of course, opportunities, right? That just means further opportunities. I see in the chat room and taking a brief look, we have some folks residing in Glendale, Surprise, wherever that may be, Mesa area. And yes, right now our main hospital is in the Phoenix area off the 51. You may see us sticking straight out there on our colorful tower. We will have opportunities venturing out to these further locations for you all. But please do not hang tight in applying. You can utilize the QR code here. Along with that growth, we recognize, of course, you know, in listening to our current employees and candidates, what are you seeking? We're hearing, you know, what works for you. Yes, benefits, you know, benefits are typically a definite need, and we do provide benefits for not only full-time employees, but part-time. And that does include tuition reimbursement, but also what else? Flexible schedule. We hear ya. You know, many of you have families, you have another position, you are going to school, and those 12-hour schedules, Monday through Friday, 8 to 5, whatever it may be, are just not connecting with, you know, your current life balance. Well, we're looking at introducing shortened schedules. So if you're going to school, let's say primarily 8 to 5, 8 to 6, we potentially might have a position for you that you could start from 7 p.m. to 10, 11 p.m. or weekends if you want to continue. So we're looking at providing these shortened condensed schedules to work around whatever your lifestyle may be. So that's newly introduced to our organization. Remote positions, yes, we do offer as well, which on our website, you can certainly filter out, you know, for remote. Many of those would be trauma registraring, some medical billing. We do have schedulers as well that are remote. So definitely take a look if that's something you're looking for at this time, and further opportunities as well. Another introduction to the organization is summer roles. We know many, you know, again, whatever your lifestyle may be, if you're a full-time student in summer, hey, you want to take a dab in, you haven't had the opportunity to work in a hospital-based role, well, summer opportunities, whether you have a child or coming in to visit, you know, for summer, you can have them pop on over and work those 2 to 3 months as well and get some experience while they're here in Arizona. So these are certainly new introduction opportunities that we're bringing to Phoenix Children's. And of course, yes, I think I may have missed, if you didn't catch, we are primarily pediatrics focused. So that is our primary focus for the community. And I always say it's a family point of care. Yes, the objective is a child, but we're here for the family. So if that's something that you're looking for, just to spread that care, you know, across, then hey, we're the employer you're looking for. But we do look forward to chatting with you further on our opportunities and see what aligns with what you're seeking. Thank you, Jessica.
Yes, fantastic. Thank you so much for being here. I was actually at an event on Tuesday night and sitting next to one of the legal counsel for the Phoenix Children's, and she was explaining to me the growth, and it's phenomenal. And what you guys do for pediatrics and children, it's really impressive. So I was so excited to tell her that we would be featuring you guys at this event. And so anyway, thank you so much for being here. It's awesome to have this these hospitals available to us.
Thank you for having us.
Yes. All right. So I'm getting some questions directly and then on the chat. We know some of you people on the call are calling in from other places outside of Arizona. And so some of you have dropped in just recently in the last couple minutes. Companies here have a base in Arizona. This is on Arizona Careers Now is the program we're on. And we have opened this call to other people that are outside of Arizona because many of these companies on the call have remote positions, have virtual, some type of hybrid, but also have positions even outside of Arizona. So I know we've heard from CVS that had job openings across the United States. There's been 3 or 4 other companies as well that have talked about positions all over the United States. So yes, there are opportunities for everybody. And after the call today, you will get an email with a link to every single job board for the companies that are being represented here today. Okay, I would like to introduce you all to Taros Health. And Heather Cepak is here. She is the manager of recruitment and HR operations. Hi, Heather. I know she's on the line. I saw her. Maybe you're muted, Heather. She might be having a problem. Let's see. All right, there you are, Heather. I see you. I just asked you to unmute. Let's see if you can see. There. Can you talk? Shoot, we still don't hear you. So while maybe you need to reset or something, we're gonna go ahead and move on to Dignity. And then maybe if you could just reset, Heather, we could try it again. Okay, all right, so let's move over to Dignity Health. And we have Connor Rich is speaking today, and I think he's coordinating with Monique Cox, but they're recruiters for Dignity Health. So hi, Connor.
Hi, good morning, everybody. So good to be here. Thank you so much for having us. I do want to talk just a quick little bit because my job is going to be a little confusing. We are bigger than just Dignity Health, but if you're in the Arizona market, that's probably what you're going to recognize us most for, that and our partnership again with Phoenix Children's. So in 2019, Dignity Health and Catholic Health Initiatives merged to form Common Spirit Health. So we are now in 21 different states around the country, and we have 142 hospitals and 700 care sites in those 21 states. So for example, in Arizona, we have 2 level 1 trauma center hospitals, and then we have 6 level 2 to level 3 trauma centers, along with about 15 standalone emergency rooms, urgent cares, a cancer center. We're now located up in Yavapai, up in Prescott, with a level 3 trauma center as well. So we have grown tremendously in the last 4 years, and we are now able to offer many, many roles, both entry level all the way up to senior executive administration. And we also have a fantastic new grad program as well. Can we please go to the next slide? So as you guys can see, we have a lot of different role opportunities within Dignity Health, most of which are going to parallel each other. So we, of course, have tons of registered nurses, radiation technologists, occupational physical therapy, and speech therapy. We range from entry-level care for outpatient services to emergency to surgery, depending on which care facility you need. We also do employ a lot of paramedics, EMTs, nursing assistants, and as well, they do have a fantastic tuition reimbursement program for almost every single level. And one of the things I'm actually very excited to announce is they are looking at a partnership with a college in Arizona to secure people with further education other than a bachelor's, but also an AA at no cost to anybody. So those non-clinical entry-level roles, we're very excited to start that program in the coming year. We have expanded quite a bit on all of our campuses with new towers, new service lines, and things of that nature. One of the things that we're really focusing on right now is those entry-level roles and making sure that everybody has a clear path for where they want their career to grow so they don't have to leave Dignity or Common Spirit. And one of the things I'm most fortunate and able to say is I lived in Arizona for a very long time. I've been working for this for 2016. I recently moved to Oregon and I did not have to change roles at all. They set me up as a remote employee very quickly and just kept me going. So this organization has a tremendous reach in all of their states. They are very much a tight-knit community, surprising to say, with that many hospitals and facilities, but a lot of what we do now is moving towards remote work or hybrid work and things of that nature. So I'm very much looking forward to speaking to everybody today in the breakout rooms. I have one, my colleague Cherie Jackson will have one. And if we can go to the next slide, I'll drop this in the chat as well, but we do have a pretty amazing website where we can connect with you. So every job that you apply to, an individual recruiter reviews your individual application and resume before it gets forwarded on to any hiring leader. So you will end up getting someone individual to be able to reach out to you if there's other opportunities as well that we think you would be a good fit for. Thank you guys so much.
Great job, Connor. Thanks for coming on today. We really appreciate it. And we have loved working with Dignity over the years and the move to Common Spirit and just the growth that's happening. And you guys saw his map. You guys have positions, throughout the United States and also remote and virtual. So thanks so much for being here today. Well done. All right.
Thanks.
So Heather is having some problems with her microphone. So she just dropped in the chat her contact information and a little bit about her positions, but I'm just going to touch on some pieces of her presentation So you guys know a little bit about Teros Health. They are a nonprofit organization. And so that's really cool to know that another nonprofit healthcare organization is here today. And so the position, and a lot of their stuff is around mental health and addiction recovery. So they run facilities throughout Arizona. And so these positions are Arizona-based positions. You can see she has direct care as well as administrative roles. And Heather, can you drop in the chat if you're still on, if these positions are all local and in person, if you have hybrid or if you have remote options as well. And so then she can talk to that. So lots of great different options. You guys know behavioral health is a market that needs support and is struggling to find great talent. And so it's a great industry to be part of. Personally, I have talked to many of you over the last couple of months that are going through some type of transition, a layoff. We've seen it in hit different industries, has not hit healthcare as much. And so this is an industry that is stable, that is growing, that we need a lot of services and a lot of support. We have IT people on the call today. And if you have been affected by a layoff recently, know that healthcare is a industry that you can jump into if you're from IT, and that you belong here, you fit in here, you have the transferable skills to be able to go right into the healthcare industry. So mental and behavioral health is a big need. And so here is Heather's email that you can apply online at teroshealth.org/careers. Again, it will be in our email. If Heather is not able to jump in the breakout rooms, at least you can contact her directly, but she will, I know she's going to try. But if she cannot, you can directly contact her. So, all right, thank you guys. That's a little bit about Teros, and we're going to go ahead then and move over to, I think, yes, Melissa is next. And so we're going to go on to Good Neighbor Support Services with Melissa Santiago. She is the Community Relations and Engagement Specialist. Good morning, Melissa.
Good morning. Thank you so much, Jessica, for having us here. We can start the slides. Yeah, perfect. So a little bit about Good Neighbor, guys. Good Neighbor is a family-owned company. We've been in Arizona for over 20 years now. We provide in-home non-medical care for over 700 members throughout our whole valley in Arizona. So not only do we care for the older generation through long-term care, but we also do care for our adults and children through the Division of Disability. So that is the members with autism, cerebral palsy, seizures, cognitive delay. So we do have over 200 members throughout the valley, assisting our members, the care that we do provide for them. What will you be doing for them? So basically we are non-medical. So there is no blood sugar checks. There is no blood pressure checks. You will be assisting them with their activities of daily living. So the things that me and you do throughout the day, you wake up, you brush your teeth, comb your hair, go take a shower, cook. It could consist of grocery shopping, companionship to appointments, things to that nature. We also have our DDD members that receive care such as habilitation. So that is for us to assist them becoming more independent with their goals, community and safety goals for our members. So our job here and our goal is always to provide amazing care for them, to keep them as independent as possible for as long as possible. We also do have family members. So we've also, if you are caring for a loved one already currently, we can go out there and have outstanding instructors that can do one-on-one trainings in the home. If you're not approved for the care yet, we can assist you with that process as well. We do know there's a lot of families out there that are already doing that for the loved ones, and they're not getting the assistance needed for it. And we are there for them at that point. You guys can go to the next slide if possible. Perfect. So we do offer bilingual training every other week covered by the company. So the only thing out of pocket for any caregiver will be their TB test scan. Other than that, I mean, we have weekly pay. We pay between $16 and $17 an hour every Friday, depending on the type of service that you provide. We have self-determined schedule, flexibility. You let us know what you can work. We find you a client to meet those needs, of course. And then paid sick leave. We always have all these benefits for you guys to make it as easy as possible. So if you are compassionate and you are absolutely looking for a career in the caregiving and looking to make a difference, we're here. So definitely reach out to us in the breakout rooms. Myself and Anissa will be on there, always hiring. So, and always running trainings, you guys. Thank you so much, Jessica, for the opportunity.
You are welcome. Great job. Thank you so much for being here. Such a great company, and what you guys do is so great to have you as part of our community. All right, you guys. So just a couple things. We have just one. This is the last company, I think, speaking today. So if you have not dropped in your LinkedIn URL yet, please go ahead and do that so we can connect with each other. Also, I just posted in the chat the Career Connectors LinkedIn group. And if you want to click on that, join our group in the community there. A lot of the companies that are hiring today are engaged in that group as well, and posting their jobs, as well as other industries and other companies that we work with. So go ahead and drop your LinkedIn URL, and I'm going to go ahead and drop in one more time how to go ahead and do that if you have not yet. So thank you everyone for connecting and engaging in the chat today. And again, hang on tight. After we hear from LifeWell, we will be giving away a couple gift cards, two $50 gift cards, and so that we can get some information from you guys that we need for our grant. So let's move on to LifeWell. Sarah Roof is here. She is the marketing manager. Hi, Sarah.
Hi, everybody. Well, thank you for hanging in there. You all are a very talented group of individuals I've been following in the chat. I'm just going to share real briefly about our organization. We are based in Maricopa County, and we are one of the largest mental health providers for low-income adults in the Phoenix metro area. So think of it this way. We really provide a lot of different types of services, almost every single type of service related to mental health outside of hospitalization. So outpatient, medical, health and wellness coaches, addiction treatment, residential, overnight staff, psychiatry. We just do it all. So if any of that interests you, I want you to come talk to me in the breakout room. We also do some housing. We have a housing specialist position open. We have medical front office positions open. If you're starting out as a nurse or a LPN, come talk to me. We have nursing positions. We have some admin roles as well that are available. In fact, we can go to the next slide and see a full list or partial list rather. Medical front office, we have claim specialist positions. If you're interested in the billing aspect of things, we got you. MAs, we'd love to bring you on board, nurse practitioners, and of course the clinical side of things. So counselors and therapists. You don't have to be licensed. We'll supervise you if you're working on getting your licensure. So that is a cool thing that we provide. And we have a lot of sign-on bonuses for the roles that you see listed here. So that's always a nice thing. I know a lot of folks are in that transition period. It can be nice to have some cushion when you get hired rather, and we just want to be able to support you and serve the community. We're really passionate about our members. Anybody from coming out of jail, starting their life to, hey, I just need some mental health support. I need to talk to a counselor. We do it all. And so we have a really exciting organization. Come talk with me in the break room and we'll connect there. One more thing, we have this QR code making it really easy for you to scan with your phone if that's something that you have in front of you. It'll take you to our careers portal. And you can browse our full list of open positions to see if we're a good fit for you. You're looking at my recruiter's contact information. Her name is Wendy. Give her a call, send her an email. We'll get you connected. And thank you so much for the opportunity. Best of luck to all of you on the call today.
Fantastic. Thank you. Another great organization that steps into the behavioral health area. So thank you so much for being here. We appreciate it. Okay, guys. So you have heard from all of our hiring companies today, and I'm going to go through some resources, and then we are going to jump into the breakout sessions where you can talk directly to the companies. But first, what we'd like to do is we're going to give away two $50 Amazon gift cards. You actually will get an email from us that says you want an Amazon card, and it's going to come from Career Connectors. And it's real. It's not a joke. It's not spam. Sometimes we give these away and I'll get a notification like 6 months later that someone finally clicked on it and said, okay, it's real. It's not spam. So here's what we need you to do. We have a quick survey and we just dropped it into the chat. So if you could click on that link, it's going to take you out to a MailChimp survey. Has a couple questions there. Basically asked you, what's your employment status? It has some demographic information and it's anonymous. The reason we do this is it is anonymous. However, we do ask you to put your name and cell phone number in there so we can text you that you were a winner and to win the $50 gift card. So the data will be separate. We are not going to give your name or contact information to anyone that's looking at the data, but we need the data because this program is a grant. And again, we're on a grant with Arizona, the Greater Phoenix Chamber Foundation. And with that grant, we have to report out demographics, the people we're serving and that kind of information. And so go ahead, click on that. And once you've done it, just drop in the chat, done. Thank you. Exactly. Just drop in done. So we know that good. People are done. Great. And then I'm going to have one of my teammates look up a name of somebody and text it to me. And we're going to give away one of the gift cards now. And then we'll allow people to finish up if they haven't. And we'll give one later today through email. So Bree, in about 2 minutes or so, go ahead and text me the winner and then I will make the announcement. Thank you, everyone. Awesome. And remember to put your cell phone number and your name in the bottom of the survey so that we know that it was completed and we can give it away. All right. So that's the survey that we're doing. And then next, just a couple resources that I wanted to tell you guys about. So hashtag AZ Careers Now is, again, the program we're on. So when you land, if you're telling your story on LinkedIn, if you can, or in your social media at all, if you can tag AZ Careers Now, we would really appreciate that and see that we were part of your journey to land into a great new job. We also have a no-cost behavioral health, or not behavioral health, sorry, not behavioral health, a no-cost behavior assessment, and it's called a DISC assessment. It's actually the opposite of a behavioral health assessment. So this is a DISC assessment. And it tells a little bit about your behavior. So your communication style, your ideal work environment, totally free, completely free, no cost to you. It's about 24 pages. You'll learn a little bit about yourself. You can pull some of the content into your resume. You can utilize some of it while you're talking about your greatest strengths in your interviews. And so you can get that on our website. Also, if this is your first call that you've attended with AZ Careers Now, or Career Connectors, you can see all of our previous recordings over the last couple years online at our CC Webinars website. And so we did one earlier this year for IT just 2 months ago. And so I know there are a lot of IT people on the line. There was a hiring event for IT. Now, granted, this was 2 months ago, but all of those companies were growing. They were not laying off. And so that's there. We have a lot of content events where we pick a content topic, we dive into that, and then we offer coaching at the end of those calls. But the content is all out there. Also, we are all over social media, so we would love to be connected with you guys on social media. And I had dropped in the URL for our LinkedIn group. That's one of the places where we really are actively engaging. All right, let's talk about some of the events we have coming up. So the next one is specific to Arizona. The other two are not, but the next one is specific to Arizona. If you are a veteran or if you are a spouse of a veteran, it can be active duty, retired veteran, anything in the military. We have an event for you. It's going to be on next Thursday, March 30th. And the lead on this event is Best Companies AZ. They're on the line. So we're featuring some of the best employers in Arizona at this event that are veteran friendly. They want to hire vets. They care about you and they work with you on transition. They have ERCs, employee retention programs, groups just for veterans. And so you'll see some of them listed there. And but we'll have at least 20 companies we have booked. We have some Vet Talk speakers that will be telling you a little bit about the culture and the type of company they have. And so it's really great opportunity if you're a veteran or a trailing spouse, that's the official word, but a spouse of a veteran, please join us at that event. And then our next virtual event is Tic-Tac-Toe. And so you're going to talk about winning strategies for your job search. And you guys, Justin Jones is our speaker on this. He is phenomenal. And so he has been in this industry for a very long time and knows what he's talking about. And then we're going to have Driving Your Career Forward with Stephanie Claire-J. And so both of those are virtual events. And then we have additional in-person and virtual events coming up the rest of the year as well. Just to note that if you are in Arizona, Arizona Gives Day is coming up on April 4th. The Greater Phoenix Chamber Foundation and Career Connectors are both nonprofit organizations. And so we do a specific day every year that says, hey, if you want to support a nonprofit that has supported you or that you care about, you will see some messages come out about this. So again, if you feel so inclined to give during Arizona Gives Day, we so appreciate that. We run on donations and grants, and we really appreciate any support. And I just want to mention Best Companies AZ. They are on the line today. We've mentioned them a couple times, and they work with some of the best companies out here in Arizona, award-winning companies. Denise and her team are on the line, and they also have a breakout room. So if you would like to talk to them about their local or remote and virtual positions for many of their clients, and you'll see these are some of the awards that they help with, or companies, their award-winning companies have that they work with. DEI, Certified Great Place to Work, Most Admired Companies, and these are some of the companies that they represent. So a lot of great companies, some that you already heard from today, and then some other ones that are not on the call because they weren't specific to the healthcare industry. All right, so now the time has come. Let me first of all see who our winner is. Okay, here we go. I like a drum roll, please. Anita Jurger. You are our winner, Anita. So Anita, you will get a text from Bree today, and then we will be emailing you the $50 Amazon gift card. You're welcome. She responded in the chat. You are welcome. And then one more of you will be getting another text from us later today. We just want to make sure if anyone didn't complete the survey that they have time. And so make sure you complete that, and we will announce one more of the winners. Likely it'll be one of you that already filled it out, but sometimes we have some stragglers and we just like to give them time. All right, so now the time that you guys have been waiting for, we're going to go into the breakout rooms. I'm going to throw this over to Bree so she can talk to you about the breakout rooms. Thanks for being engaged today. Thanks for being engaged in the chat. I just want to tell you all that if you are going through a time right now where you're unsure, you're not sure of your next step, I know a lot of you are on the call because you are going through a layoff or have gone through a layoff, or you're actively in career transition. I know it can be scary. I launched Career Connectors almost 14 years ago because personally I was affected by a layoff, and my husband and I were both unemployed at the same time, and it can be super scary. But I am telling you, I can say without fail that this layoff is one of the best things that ever happened to me in my life, in my husband's life. I get to run this amazing organization with some amazing staff and partners. My husband turned his career into he's a counselor, a therapist now. And it was because of those layoffs that pushed us in that way. So if now is the time for you to open up your mind to different career opportunities, take the step. And do not be fearful, and just move forward, and know that we are praying for you, that you land into the career of your dreams. Thank you so much for being here today. Bree, it's all you.
All right, so I'm going to open the breakout rooms. And then on this next slide, you'll see just some tips on what to do, but I'll go over quickly the directions. In just a couple seconds here, I'm going to open all of the rooms. So you'll see a list of the rooms with the company name. Some of the companies have 2 rooms each.
So you're going to go to your toolbar, which will be at the top or bottom of your screen, hover over breakout rooms, click it. The entire list of companies will come up, and then you will go to the right, click join. It'll take you to that room. If you want to come back to the main session at any point in time, do the same thing, go to your toolbar, click breakout rooms, and come back to the main session. So I am opening all the rooms right now, and you'll see them come up. And I am going to pull up a list right now with all of the breakout rooms. I do have to make some edits because we've had some edits come up during this presentation. So I'm going to stop sharing, and then once everything's updated, I will share in just 2 seconds. Thank you.
All right, thank you so much, Bree. And so companies, you should be moving into your breakout rooms now. Great, we see that happening. And now, again, on the bottom of your screen, there should be a breakout rooms icon. Click on that icon and then choose, there'll be a blue join button. Choose the room that you want to join, and you can go join that room. Notice that, again, some of the companies have more than one room. So you can go to either room. If you go into one room and it seems full, feel free to jump into a different room. And you can just kind of move from room to room throughout the next hour. We have an hour throughout the next hour. So you can talk to different recruiters at the different companies. If you're having any problems with getting into a room, just drop in the chat where you would like to go, what company you would like to see and go talk to. And then we will try and help get